I'm a member of different medical organizations, and I've been on the receiving end of many communications over the last weeks over ever-evolving guidelines. Most of these guidelines speak to who should be tested for the COVID-19 disease. Initially, the guidelines back in January related only to travel to Wuhan, and then when the disease made its way to the United States, that criteria was dropped, and then we were given other criteria regarding testing. But these two are continuing to evolve, but still, in my humble opinion, they are overly restrictive. I'm going to be making the case in this video that the testing requirements currently proposed not just by the CDC, but by many healthcare organizations throughout the country are inadequate. This situation is mirrored by the United Kingdom as well as other countries. We are simply not testing enough, and every day that we live in a world without widespread testing is a day that the COVID-19 virus continues to spread. There are still many people here in the United States who believe that the entire thing is a bunch of hype and we're going about their daily lives without any idea of the gravity of the predicament that we find ourselves in or the suddenly dire importance of social distancing. The reasons for their skepticism are many, ranging from a fondness of conspiracy theories to distrust of the media to inaccurate comparisons to the flu. But part of this skepticism is no doubt because we haven't yet detected the tens of thousands of cases out there that are undoubtedly already here in the United States. Current guidelines tell us to offer testing to patients who have known exposure to COVID-19 patients if they have a fever, cough, or shortness of breath. Chances are that if you don't meet some of these criteria, you won't be offered the test. That's what the guidelines say. But what if you don't know that you've been exposed to COVID-19? And what if instead of the classical symptoms of cough, fever, and shortness of breath, you're a young person that has very mild symptoms? Current guidelines will not be able to offer you a test, so the chances are that if you just have very mild symptoms, you'll forego getting tested and mostly go about your life without making any changes. There's little motivation to isolate yourself because with symptoms being mild, it's easy to convince yourself that you probably don't have it. So you'll go about meeting with your uncle or your grandmother or that friend. Maybe you'll go to the grocery store and run that errand. And God forbid, you might even go to work where you're surrounded by lots of other people. We are under testing right now, and as a result, we're failing to capture thousands of people with mild symptoms who, not knowing their positive state, go around infecting other people or otherwise do not take the aggressive quarantine precautions necessary to slow down the spread. It almost makes less sense to test patients who clearly have COVID-19 symptoms at this point, because we're in the middle of a pandemic. If you've been around a patient with COVID-19 and you now have a fever and a cough, well, what else could it be? Why even get tested in that case? The goal we should set for ourselves is to over-test right now. We need to capture as many cases as we possibly can so we can have an accurate sense of the scale of this problem and know who should be quarantined. So what would my testing criteria be at this point? I say that if you have the slightest symptom of a respiratory problem, you get tested. I would set the bar very low for testing. You have a stuffy nose? Get tested. Have a low-grade fever? Get tested. Have a slight cough today? Get tested. Is your dog not feeling well? Get tested. And this might mean that a person might get tested multiple times over the course of weeks, but so be it. The goal should be to overcompensate right now and draw an accurate map as possible of the extent of disease burden. Now, I am fully aware that upscaling tests is expensive, but this is absolutely not the time to be worried about the cost of testing because the costs of hundreds of thousands, if not millions of people flooding our healthcare system dwarfs the cost of testing. I'm also completely aware, 100% aware, that the current restrictive nature of the official guidelines are a matter of necessity. We just don't have the testing capacity right now, and so we have to be discriminating in cases that we test for. I get that. That's fine. But the current position from governments and healthcare organizations should be that we would like to test almost everybody who comes to us to be tested, and that we don't have that yet because we didn't appreciate the gravity of the problem, but we are now pulling all the stops to get tens of millions of test kits out there for the public, and that is our biggest priority right now. It's job number one. Nothing is more important to us than getting more tests out there. And that is the only correct posture here. Anything else is unacceptable at this point. As a member of the public watching this video, you should eventually have a rapid turnaround test available to you. Let me remind you that in a few short weeks, South Korea had tested over 100,000 citizens and was able to provide 10,000 tests a day. A capacity to over-testing should be the expectation we place on our leaders right now. Failing that, the exponential rise of this disease will go unchecked as we keep groping in the dark and wondering how widespread it really is.